recognise that prioritising the rights of women and girls is integral to the international development. As you know, much of this can be traced back to the International Conference on Population and Development in 1994, meeting where 179 governments adopted the Revolutionary Programme for Action that recognised sexual and reproductive health, women's empowerment and gender equality as key to development. Additionally, the Sustainable Development Goals include several goals related to health, education and gender equality, and include many aspects of sexual and reproductive health and rights. While there has been some progress towards these commitments, there have been setbacks due to Covid-19 and worldwide pushback against sexual and reproductive health and rights. First and foremost, I'd like to just ask you if you could talk a little bit about the Covid-19 experience and what that has done to development in this space.
So the COVID-19 pandemic has been a huge setback right across the Sustainable Development Goals. The number of people living in extreme poverty grew for the first time this century and has grown quite a lot, many tens of millions of people. And similarly, those pushed to the brink of starvation have grown very, very sharply in number. All this now exacerbated, of course, by the compounding effects of not only climate change, but the war in Ukraine, which has threatened food security for people around the world. So with respect to girls, we found that during the pandemic, of course, many children were out of school. UNESCO estimated that 11 million girls would never return to school at the end of the pandemic lockdowns. And unfortunately, that then means those girls will probably go into early marriage in many cases and early childbearing and face more risk of maternal mortality and so on. The level of disruption in core health services during the pandemic was considerable, and sexual and reproductive health services were severely disrupted in something like 40% of the countries surveyed by the World Health Organization. So that meant girls and women couldn't access contraception. They couldn't access safe abortion, even where it had existed pre-pandemic. Births were less safe. There was less prenatal and postnatal care. So all in all, a huge setback. Also add to that domestic violence against girls and women soared in the period of the pandemic. When the figures finally come in, we will see what's come out of this is more adolescent pregnancy, more unplanned pregnancy in general, more maternal mortality from birthing that couldn't be coped with, and more stillbirths. It's not a good story. And what it says is that when countries are planning the resilience of their health services, these basic sexual and reproductive health services has to be seen as part of the core health service. These are not optional extras. Women need their contraception every day. So they need access to these services all the time. The biological clocks don't stop because there's a war, a pandemic, a climate crisis. So building these basic services for girls and women into universal health coverage as core services is so critical.